evening and welcome to tonight's board meeting of the Oakland County Health Network. Our first order of business is, if you can, please rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, for which it stands, one nation, indivisible, with liberty and justice. At this time, I'll roll call those present.
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles. Pastor Jones.
Present.
Ms. Woodruff.
Here.
Dr. Hans.
Here.
Ms. Newman.
Here.
Ms. Root.
Here.
Ms. May. Here. Mr. Torres.
Here.
Mr. Cowan.
Here.
You have quorum.
Thank you. At this time, we have an opportunity for public comment. We have those both online. We traditionally take first, and then anyone in the audience. We ask that you limit your comments to 3 minutes. At this time, do we have anyone who's on line with us?
If you are online and wish to speak for public comment, please raise your hand at this time.
There's no one online. Is there anyone in the audience who wishes to address the board this evening? Yes.
Hello, my name is Joy Wilkins. I'm gravely concerned for my family. My sister and brother rely on the care of direct support professionals for their health and safety to live independently in Oakland County. I'm here advocating on their behalf in support of appropriate levels of compensation for direct care workers. My sister and brother require 24-hour care. Hiring, training, and retaining essential caregivers is difficult without adequate wage increases. I respectfully request consideration by this board when approving the fiscal year 2024-2025 plan and budget. Next, I'd like to ask a question, and if you're unable to respond now, I look forward to your answer in your public comment response. My question is, if reductions are necessary in the next fiscal year, will admin costs be considered before cutting supports and services, particularly since no person served is overserved? Thank you.
Okay. We won't respond now. We typically don't, but we will provide a response to you.
Thank you.
Okay. Thank you. And by the way, ma'am, Ms. Wilkins? Where are it's your brother and sister? Where are they located generally in the county? You don't have to give me an address, but.
Oh, they live in Troy.
They live in Troy. Okay, just curious. Thank you. Okay. Is there anyone else who wishes to address the board? There being no one, we'll close public comment. There is an opportunity for public comment at the end of the meeting. At this time, I need the approval of the agenda, and we do have one addition I want to bring to your attention. Our legal counsel has asked for a closed session at the end of the meeting, so after board member comments, we'll go into closed session. Are we going to do it here? We're going to do it here? And, pardon me? Okay, but when we come out of closed session, there are no other items on the agenda, and we don't intend on placing anything else on the agenda unless the attorney says there's something we have to act on. So that will most likely result in adjournment. So at this time, do I have a motion for approval of the agenda as mentioned?
So moved.
A motion of support and approval? I'm sorry, support? Okay, all right. We have motion. Is there any discussion? All those in favor say aye. All those opposed, the motion carries. All right. The next item we have is Stories That Inspire Hope. Suzanne Weinert, if you would bring up our guest, please.
I'll go ahead and introduce really quick, okay? Good evening. It is my pleasure to introduce you to Jacob Berman. And Jacob was honored last week at the Your Voice, Your Value conference. And Jacob is our Achievement Award winner for the Dan Moran Award. And I just want to read a little bit about Jacob, and then he's going to tell you his story. Just a little bit also about the award, a little information about what the Dan Moran Award represents. So the Dan Moran winner promotes the rights of individuals, encourages self-advocacy, raises awareness about developmental disabilities, mental illness, and substance use disorders, and breaks down boundaries. As an OCHN recipient rights trainer, Dan Moran instilled hope and demonstrated that dreams are possible for all people. And just a little bit that we learned about Jacob when he received his award last week. He is an active contributor to the Gesher Human Services Choices and Creative Expressions program, where he's embraced the person-centered planning process and is active in the community. He's always willing to participate in the Creative Expressions program and has bloomed as a talented artist. He recently designed clothing and modeled for the Choices Program fashion show, and has had his art displayed in one of the Detroit Symphony Orchestra neighborhood concert series. In his paintings, Jacob identifies with the theme of peace and mutual support of each other worldwide. He helps to make decisions in the programs and the spaces, and is a participant on the advisory board, the Consumer Power Initiative. He also serves as a participant representative on the DM Safety Committee, where he brings suggestions and feedback at monthly meetings on behalf of participants. So he is truly an advocate. And next, I'm going to turn it over to Jacob and Mrs. Berman to tell his story.
Hello everyone. My name is Jacob Berman. I am 43 years old and I started Choice program in 2007. For all those years I felt so welcome there. Choices programs offer so much of outings to special places, parks, nature sites, CCA. I can always utilize my electric wheelchair for outing because of thin transportation service on board. All my needs and wishes have been fulfilled. During COVID-19, when Gesher worked on Zoom, staff set up virtual programming, including chair exercises. We were introduced into interesting discussions. Everyone could participate and bring new subjects. We learned historical facts about different countries. We talked about national and Jewish holidays, and even had cooking sessions. The program started at 9 a.m. and ended at 3 p.m. 5 days a week. Gesher Choice program treats all clients with respect. I like bowling a lot. The most of all, I like art and craft program. I am enjoying painting very much. Some of my artwork was on display at one of the Detroit Symphony Orchestra's neighborhood concert series. In Gesher, I participate in all activities. I also try to help staff with some tasks. I love my leadership in safety committee, where all of us discuss how to be safe in different environments and situations. I love Gesher. I love staff. I love transportation service provided through JFS. I am so sure of one major thing. Without Gesher's support, I would not be well adaptive to the world and won't feel good emotionally. Thank you, Gesher, for nominating me for Dan Moran Award, and thank you, Oakland County Health Network, for choosing me and presenting it to me. I feel honored and privileged. Thank you all.
Mrs. Berman, do you have anything you'd like to share? Yes, I do. I know it's a hard act to follow, I will add.
Actually, also, we appreciate my husband, my cousin, and I appreciate the award presented to Jacob very much, and it means a lot to all of us. And also, I wanted to mention that the transportation services is going to end through MORC in the end of this month, I believe, and or September, I think September. And as of October 1st, the Oakland County Health Network is going to pick it up. So again, you are going to impact every person who is using services, every person. And it just, we're so grateful that words cannot even explain how much thankful we are. So God bless you all, and God bless America.
Thank you very much. Does anyone on the board have any questions, thoughts? Go ahead.
I just want to congratulate you, Jacob. I was at the Your Voice, Your Value conference, and where I was sitting, I couldn't see who they were talking about. And all of the accomplishments that you have been able to make are amazing. So keep doing the great work that you're doing and being the advocate that you are. Thank you.
I just want to add, go ahead.
Thank you.
I just want to add, first of all, your speech was very impressive. But more importantly, we just all watched the Olympics and we saw a number of champions. But you are a champion here, not just for yourself, but for others in our community who need advocacy and need people, because not everybody has a voice. And you have a voice. It may be an electronic one, but you have it. And you are using that, and that is to be honored. And we are very pleased to, all of us, congratulate you on the Dan Moran Award. And thank you, and keep up the good work, okay? Good. All right. Thank you. Thank you very much for coming this evening, and for your family for joining us also. Yeah. Dad, you're right about that. It was a good job. We'll continue on now with the rest of our meeting, although, like I mentioned, that's a hard act to follow. First is the board chair report. Have been participating in some meetings about year end, and then, of course, our budget, and there'll be more to report on that later. But I also have some good news to share. I think it's good news with the board that today we learned that a former board member, Sarah Guadalupe, was nominated and recommended to the full Board of Commissioners to be our 12th member. I thought Sarah distinguished herself as a board member. She had to move out of state for a while to take care of family, but she has been back and interested in serving again. So I believe the full board is going to consider this of commissioners on September 5th. So hopefully she'll be able to join us next month at some point once we get all the paperwork in order. So next is our Finance Committee Chair, John Young.
Thank you. In the committee of the whole, the finance portion, we elected a vice chair. Pastor Jones was duly appointed as vice chair for the finance committee. We had the financial overview, and as most nonprofits in 2024, we're experiencing financial headwinds in a number of areas. Patrick walked us through the financials through June 30th. Something to note, June should be the lowest point for eligible count redetermination technically has ended, so the numbers should not be going down. Hopefully, some of those who are classified in categories of lower payment incorrectly should be moved back up to the higher paying categories. On the liability side of ledger, there are a few timing issues. If you look at the bigger financials, those should be corrected in the month of July. We're expecting a budget amendment number 2 in September, and we also recommended the Civic Plus contract to come forward to the full board tonight.
Thank you. And then for Policy Management Committee, our chair, Yvette Woodruff. Sorry.
Okay. There were 4 action items under Policy Management on the Committee of a Whole agenda. The 2 items were presented by Suzanne Werner, Director of Communications and Community Outreach, the proclamations for the month of September for Recovery Month. The second item was Suicide Prevention Month proclamation for September as well. After brief discussions, the Policy Committee recommended that both proclamations be sent to the full board for a final review and approval. The next order of business was from Ms. Vicki Suter, designee for the Director of Rights and Advocacy. Ms. Dow presented, there were 2 recommendations, one for the reappointment to the Advisory Committee to complete an unfinished term, Mr. Hunter Parker, and based on his prior service, the Policy Committee unanimously made the recommendation to send to the full board for final review and approval based on his prior service and commitment while serving. The next item for consideration was to replace former board member Mr. Jonathan Landsman as a representative on the Appeals Review Committee. Board member Adam Furman explained that this committee meets minimally 4 times per year, but on an as-needed basis. Board member Christina Root volunteered to replace Mr. Landsman on this committee. The policy group made the recommendation to support the appointment unanimously. Dr. Hans did remind the group that she serves as a liaison for the board on this committee. That concludes the items that were discussed under Policy Management at the Committee of Whole meeting on August 12th.
Thank you very much. At this time, we will move on to our business items. First, we have the Civic Plus contract, which was reviewed at the Committee of the Whole meeting and recommended for approval.
I think Chris is here if there are any questions. I'll just kind of introduce it, and then you can give like 30 seconds about what it is. It's essentially a contract amendment for 1 year. The annual cost is $14,302. Website development and administration will be competitively bid in 2025. So maybe give 30 seconds about what it is so the full board can.
Absolutely. Thank you very much. We've been working with Civic Plus for the last 3 years since 2021. We're about to end our 3-year contract with them, and we're just looking to extend for another year to allow them to continue to administer our website hosting and development.
Thank you. If there are any questions, you can entertain those. If not, I'll look for a motion from the committee for approval.
So moved. Support.
A move and a support on the contract. Is there any discussion? There being none, a roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Yes. Ms. Newman?
Yes.
Ms. Root? Yes. Ms. May?
Yes.
Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you
very much. Thank you, Chris. Next item is our approval of the Suicide Awareness Proclamation. This was read in full at the Committee of the Whole meeting, and I'll just note that September is National Suicide Prevention Month. World Suicide Prevention Day is observed on September 10th. Our network is committed to being a zero suicide organization, and this resolution will be distributed to government agencies and others that they can share in their communities. So do we have a motion and support?
So moved.
A motion? Motion and support. Is there any discussion? A roll call vote, please.
Mr. Torres?
Yes.
Ms. May? Yes. Ms. Rue? Yes. Ms. Newman?
Yes.
Dr. Hahn? Yes. Ms. Woodruff?
Yes.
Dr. Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Next, we have a proclamation designating September of 2024 as National Recovery Month. Again, this motion was read into in full at the Committee of the Whole meeting, but just to note that 2 years ago, 17.3% of Americans 12 years or older were classified as having a substance use disorder, including alcohol and drug use disorders. That is a big number. But we are committed to educating and raising awareness, as well as providing services to those who are in recovery. And we would ask that everyone support those who are in recovery, and also urge those who need help to seek recovery services. Do we have a motion and support? Moved and supported. Is there any discussion? Roll call vote, please.
Mr. Torres?
Yes.
Ms. May? Yes. Ms. Rue? Yes. Ms. Newman?
Yes.
Dr. Hahn? Yes. Ms. Woodruff?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Next item on our agenda is a follow-up from our recommendation of last of the COW meeting, and that is our CEO Evaluation Committee recommendation. As all of you know, we have been in this process for a couple months, which we do every year, and at the Committee of the Whole meeting, prior to that, the Executive Committee, which is 5 members of this board, who also serve as the CEO Evaluation Committee, recommended to the board that the CEO be awarded a 6% performance merit award and a 3% salary increase. The vote was 4-1. The basis of the recommendation was that we have a process that is contractual that we use with the CEO. It involves us ranking the CEO in 12 different categories. The average score ranking was 45. We have a matrix compensation chart that we use, and that fell into the recommendation of 6% merit award and 3% salary increase. And we made the recommendation after hearing the comments and input from the board members, which was part of the process, and also a meeting that we had with the CEO to discuss performance. So I want to thank everybody for their participation in the process, including Dana, and also I want to thank Glenda Witherspoon, who's our interim HR director. She provided us with a lot of data and information and organized everything in a fashion that was cohesive so that we could make decisions based upon that data and information. So I placed that before the board for action. Motion and support. Is there any discussion? Yes.
I was the one dissenting vote in that meeting, and I felt that we need to do a better job with the evaluation process. Instead of giving her a 6-month review, I'd like to recommend that we do quarterly, because I feel like Dana should be given an opportunity to speak to her detractors. Some of the scores were quite low, and I don't think it's fair to her as our one employee to have to go a whole year and be surprised at the outcomes. And if you're scoring her the way that you did, you should be able to justify those scores. So I hope that the board will take under consideration, instead of just doing a 6-month review, that we review quarterly.
Is there any other discussion?
Yeah, I would support that as well. I think I brought that up last year with the evaluation committee, and we were doing 6 months. We're just doing the annual, but I think it's important that those quarterlies. Yeah, I think that way, if there's any issue, any problem, or any adjustments, they can be made. The 6-month I appreciate, but I know right now the way we did that was it's just a check-in. But if we could have more process to it, I would be in support of that as well, because I think it's important, especially when you have a CEO, that they be aware of where the board stands on issues and anything that they have concerns about, so they can be addressed, accordingly, or adjustments can be made. So I would support that we relook at that structure and do more check-ins. Thank you.
All right, is there any other discussion?
Yeah, I just need a little bit of a clarification. John Paul, you recommended that this quarterly evaluation or periodic evaluation be done by the whole board or the evaluation committee only?
Well, I think the way that we structured it last year is that we said 6-month check-in, and I don't know that it happened at 6 months this year. I think it was a little past, but I can't remember, somewhere around there. But the spirit of it was what I had stated, is that way we can check in and we can make any adjustments, accordingly. The way that I believe we put it in was when we were talking through the contract last year, is that it would be with the whole board. And I think it was the whole board would be involved. So I would support that the board be involved, and it doesn't have to be anything formal. Maybe some structure to it, but that it be more like an informal check-in. And I can tell you, as I sit on a school board, and we do that with our superintendent. It's a recommendation from the Michigan Association of School Boards. We went from annual to 6 months and then to quarterly, because what we were finding with school superintendents was the life of them, as far as how long they would last, their tenure, was very low, and it's harmful to productivity, it's harmful to student achievement, to student growth. And so the state association came in and said that this was a best practice, and I have long thought it's a good practice as a public administrator, to make sure that individuals know where it is that they're at. So I would support the whole board of those who want to be involved would be involved.
Yeah, I agree with that, but I think the parameters that we evaluated under should be consistent throughout the year. Like, I don't know who designs these evaluations, but I think it was kind of very complex, and I don't know where it exactly came from, but we have specific role as board members, and as an organization, we have specific duties. We are the, guardians of the public funds that are supposed to be used for services to the people, and that is important. And I think the other thing is some of the issues that came up were the internal processes. So input from within the team, within the organization, as well as the stakeholders outside stakeholders will also be critical. Of course, that can't be done every quarter, but that would be an important indicator of our performance as a whole, of the board as well as the CEO.
Is there any other discussion on the motion? I just, again, want to thank the Evaluation Committee and all the board members for their participation. We had a lot of issues that we faced this year, and we're still, dealing with some of them beyond our control. But we have plans, and accomplishments were made in this last year by Dana and her team, which we're happy with. And we have other things that we know we continue to work on and fill some positions and things of that nature, which I know you're working on. So at this time, if there's no further discussion, I'll ask for a roll call vote.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root?
No.
Ms. May?
Yes.
Mr. Torres?
No.
Mr. Cowan?
Yes.
Motion carries.
And if there's no objection from the board, I would ask that, Sheila, if we could communicate to our legal counsel, Kalana Ali, if she could look at a way for us to have the quarterly meetings of the full board.
Yeah, she's
And then-
online right now.
Okay, well, then Kalana, if you can report back to us at our next meeting on the way we could do that and for the full board to participate, I think that's an excellent suggestion. Okay?
Absolutely.
I'm going to assume she heard me. If not, we'll talk later. Okay.
Absolutely, I heard you. Sorry.
Okay, that's fine. All right. Our next item on the agenda is our RCAC recommendation, which we discussed last month and received a memorandum and presentation from Vicki for Mr. Hunter Parker. I'm sorry, Vicki Suter, who made that presentation, to recommend for appointment to the Recipients' Right Advisory Committee, a former member, Hunter Parker. Do we have action on that item? Support. A motion and support. Is there any discussion? A roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Ms. Newman?
Yes.
Ms. Root? Yes. Ms. May?
Yes.
Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Okay, the next item we have is the fiscal year MDHHS CMHSP contract. Could Kalana give us a update on that, please?
Hi, this is Kana, legal counsel at OCHN. As you can see, we have received the.
Klana, we can't hear you.
Can you hear me now?
A little bit better, but not.
So we recently received the CMHSP contract from the department for review. This contract covers our general fund that we received from the department. It's in the amount of, I believe, $10.9 million allocation. This covers all of our CMHSP activities under the statute, mental health code.
Okay, did everybody catch that? Sheila, can you repeat what the number was?
Yeah, it's up there.
Okay. says $10.8 million. Okay. For our mental services health program with the state. Okay. And that's being recommended for approval. Do we have any action on this item?
Move for approval.
Motion and support. Is there any discussion? All those in favor say aye.
Aye.
All those opposed, the motion carries. The consent agenda is for,
Mr. Cowan?
yes,
All right, apparently we're loud now. I do have a point of clarification because I wasn't at the town meeting. Did the full board vote on the appeals committee member, or was it just that committee? From her report, it sounded like it was just that committee, so. Okay.
Yeah.
Okay, so then I can say the full board in these, okay, in your notes, okay. I just
Right.
want to make sure the minutes reflect that
Right,
the
we're
full
all
board voted.
Okay. We're all set on that then? Okay. The next item is our consent agenda, which is meeting minutes from our last board meeting, Recipients' Rights Committee of the Whole, and SUD Oversight Policy Board.
Move for approval.
Support.
Motion and support. Roll call vote, please.
Mr. Torres?
Yes.
Ms. May?
Yes.
Ms. Root? Yes. Ms. Newman?
Yes.
Dr. Hans? Ms. Woodruff?
Yes.
Pastor Jones?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Our next item on the board agenda is June finance reports, which were presented last month, and those are received and filed as per our customary practice. We are in our, nearing our last quarter here, in the midst of that right now of our fiscal year, and I'm sure more to come from our finance team. Next, we have board reports, the SUD Oversight Policy Board. Sarah May.
Thank you. The Oversight Policy Board met on Wednesday, July 31st at 1 p.m. here at OCHN. We received our quarterly financial update with quarterly budgeted revenue being about $23,009,000. We unanimously approved the $4 million PA2 request in order to absorb the decrease in SOR funding and supplement the projected budget overages of the GF and BG and the prevention expenditures. Both Medicaid and the Healthy Michigan Plan present a net surplus at this time. Megan Phillips provided an overview presentation on recovery incentives pilot program, which OCHN was awarded from MDHHS. The RI pilot offers a 24-week outpatient contingency management service for eligible Medicaid beneficiaries with qualifying diagnosis of either stimulant use disorder or opioid use disorder. And the incentives provided are gift cards of up to $599 per individual served, and it's distributed via an incentive management program, so it's kind of like an app that as soon as you complete one of your goals, it's immediately sent to you, so it's like an instant reward. The program is for 2 years and will continue through September of 2026. And the next meeting of the OPB will be November 20th at 1 p.m. at OCHN.
Thank you very much, and thank you for your being a liaison for us on that committee. Next is our Citizens Advisory Committee, Christina Root.
Thank you. Our meeting was on July 17th in the morning, and it was all virtual. We had an OCHN clinical supervisor present an individual plan of service audit review, and then we had Christine Burke and Dana Lassenby, our CEO, speak about current events at OCHN and advocacy efforts. We did have several members ask questions about upcoming transportation changes. I'm guessing that will continue to be a hot topic in our committee. And that was the majority of our conversation. So our next meeting for this month is actually tomorrow, and it's in a hybrid format. So we'll be here and online, and that's at 9:30 a.m. Thank you.
Thank you, and thank you for being our liaison to the Citizens Advisory Committee. Next, Recipients' Rights Advisory Committee, Dr. Hans.
Yes, the committee met on August 1st, 2024. The minutes have already been approved by the board. Some of the key items that were covered were a presentation was made by Kaylin Toth on voter registration and participation in the election process. There was a lot of discussion on that, and a lot of information was exchanged. I think more people will be able to participate in the forthcoming election, it's hoped. Nomination for the Dan Moran Award were discussed, and we have already heard from this year's recipient, Jacob Berman. That was unanimously approved. The next item was, important item was the concerns of the committee that are issues important to the RRSC. That is goal 1 of the committee. Some of the key questions that were raised in that discussion was concern about the budget. Apparently, there is going to be a shortfall. The questions that were raised were what impact it will have on the services to the people. There is also concern about the administrative policies of the organization, and it is hoped that careful assessment will be done for these evaluation of the internal policies of the organization, because these have a direct impact on the people. Aside from the preceding comments, there were no concern that they raised for the book to be conveyed to the board at this meeting. So those were the key things. Recommendation for the vacant committee position was made for Hunter Parker, which has already been approved by the board. The next meeting will be September 5th at 4 p.m. in this building. Respectfully submitted. Thank you.
Thank you very much for that report, and thank you for serving as our liaison to the Recipient Rights Advisory Committee. At this time, is there any other business to bring before the board? There being none, next is our director's report, Dana Lazenby. Thank you.
Thank you, and good evening. I'll go through my report briefly just to highlight some of the things that we've already talked about, and the most amazing one was Your Voice, Your Value conference that was here earlier in the month, and we had over 100 people fill this room and to hear the important messages about ending stigma, the voting rights, and OCHN's fiscal year annual plan. Many people came together, as you see from Jacob. He was one of 12 to receive an award, and so it was exciting to have a lot of the family members as well as our stakeholders and partners in the room to celebrate the accomplishments of people we serve. Also, in terms of access, we're continuing to look at access and ensure there are no barriers. We continue to work with Oakland County Health Department, who have identified a space for us to use in Southfield office, and we are working to staff that office to ensure that people have an opportunity to access services when they also go to Oakland County Health Department for other things. Also, in terms of working with the Oakland County Exec and the Board of Commissioners, I think I did tell this board last month, we had a soft opening of the walk-in center or the integrated urgent care with honor in the Oakland County Health Department. It's been a slow start, but as we move forward and get the communication out to the community, I'm sure we'll see more people take advantage of that. We also are working to ensure that our staff are trained and ready to receive individuals who may be seeking those physical health as well as those mental health services and supports in real time. We are also, I should say, working with the Tri-County or Metro Region and the interim CEOs of Manny Singla from Detroit Wayne and Tracy Smith, which I believe she's permanent now, I hope so, to talk about some of the concerns we have in our work with with the Michigan State Department of Health and Human Services in upcoming contract language. And 3 of the high-level things that we will talk about in terms of advocating for change have to do with the CCBHC language in our PHP contract, as well as our internal service fund, and the Wasco lawsuit settlement, which you'll hear more about later on. The other things that I wanted to just really be proud of our team and the work we're doing with county, again, in Oakland County's 2024 annual report, OCHN's work is highlighted as a collaborative partnership, and we have very high mentions as it relates to our crisis intervention teams, training, the school mental health navigators, the school mental health benefit, as well as the law enforcement co-responders expansion. So we're really proud of the work we're doing with the county to make sure that we're getting the word out, that we're having crisis intervention services through our law enforcement, but also working with the schools. We know that's a critical area in which we need to continue to educate families and the community about accessing mental health services. There is a report also of our school mental health navigators, and it talks about the work that they're doing, and there is a link in my report that you can go and see that information. The other thing I did want to highlight is our upcoming recovery celebration on Friday, September 20th. It's here at our Troy office. We invite you all to attend. Normally we have over 400 people come to that big event, and it is a celebration of recovery, so we invite you all to attend. And I do want to thank those board members that are able to come to our community events. It means a lot to the community to see you there. And thank you, Ms. Newman. She was there at our Your Voice, Your Value conference, and it was good to get that exchange and be a part of the celebration. There's a 20-year anniversary for one of our substance use prevention provider partners, and that is the Alliance. And in their 20-year impact stories, they highlight our very own Megan Phillips, our director of SUD. And let's see, what else do we want to cover? I think that's basically it. If there are any questions. Oh, I do want to recognize also our team, and we received, again, for the second year, the Platinum Bell Seal Award for Workplace Mental Health, and it's from Mental Health America, which is a national organization that recognizes the mental health of the workforce. And then also our SUD team, again, we should celebrate them in passing the SINAR study, and this is a state requirement that we have young people go around as decoys and try to buy tobacco. And so when we send people in and they're refused to sell, we have the score of 91%, and that is a very good score to have. So other than that, we're doing a lot of amazing things, and we are addressing the questions that come to us. Our leadership team is addressing multiple questions as it relates to transportation, as well as the transition of the fiscal management services, and looking at the timeliness and the phases that we'll go into to make sure there are no gaps and people don't fall through the cracks in terms of those transportation services or other self-directed services that people have. Ongoing advocacy for the direct care worker in those wages. We know we had a 20%, I keep saying 20%, but a 20-cent increase added to those wages, and we know it's not enough. So we continue to work with the Tri-County as Metro Region, as well as across the state, to address those needs that we know we are all having due to redetermination of Medicaid and miscategorizing of individuals and where they fall. But also, now that the public health emergency is ended, part of Medicaid redetermination is that people are finding themselves on Medicaid spin downs, which is really, in essence, not having Medicaid until you're able to establish that you have a need and show receipts that you have met your spend down amount. And it really is something that has hurt us financially year after year, but not so much us, the person who needs services. So if there's a break in service or they're not able to demonstrate a Medicaid need, they often lose their Medicaid. And really, they don't have it anyway if they have to continue to justify each month that they should be eligible for Medicaid. So it really is, I don't know why they return that piece of it, because it really just punishes people who find themselves in a situation where they may have a little money, which is not really enough money to cover their service needs.
Thank you. Does anyone have any questions for Dana on her report or other items? I have one. Transportation, we're still on goal.
October 1st.
October 1st?
Yes.
And how is that?
There are questions, of course, and there are always concerns when you have major changes, but the team is working diligently to make sure that those authorizations are in our system, and those providers that are going to continue to provide those transportation services as a 10-1 are on board, and then the others that have decided maybe they don't want to continue with a contract directly with us, we are finding other alternative providers of transportation to ensure there are no gaps and those services continue.
Okay. All right. I'm sure more to follow.
Yes.
Okay. All right. Anyone else? Okay, we're all set. Now we'll, our usual conclusion of the regular meeting would be with board member comments, and Adam, I'll start with you.
Thanks to Jacob for telling his story. I didn't know whether to mention it during the comments for after his presentation, but I believe I actually went to preschool with Jacob, so I've known him for a very long time, longer than I'd like to admit in terms of years, but that's beside the point. But yes, it was very inspirational to hear him, and thank you very much for all staff who put time in to cement the agenda, and have a good night.
John Paul Torres.
Thank everybody for the meeting tonight and all the material and information. I cannot stay for the closed session. I have another meeting that I have to be at in Waterford at 7 o'clock, so in 5 minutes. So, appreciate the meeting tonight and all the information. Thank you.
Okay. Yeah, double duty tonight.
Yeah.
Yvette Woodruff.
I too want to thank Jacob for the stories that inspire. It is very inspirational to see how different people handle the adversities that they have been given in life. And I wish him continued success along this journey. Thank you.
Melchiah Newman.
No comments.
John Young. Pastor Jones.
I'd like to, again, join with you all, too, in thanking Jacob for his report today and the accomplishments and the award that he has received. So I want to thank him. I know he's left, but I want to thank him for that. And then I also want to thank Suzanne for emphasizing this month being, or month coming up, suicide, because there is such a high level of suicides going on, and within our young people, that's happening. So I'm excited about the focus and the attention that's given, to that. In addition, we talked about recovery, and alcoholism is another issue that we really need to make sure that we're focusing on. So thank you very much for for putting out the information so that we can even pay more close attention to those two areas. It's very, very important. It is good to hear that we're still working on the transportation piece, and I hope that we have some way of evaluating the services that we give in that. I sometimes stay with my buddy over there when his rider's coming, and so I got a good feel and a good sense of what the value of transportation is and the level of service that they're giving. So thank you very much for continuing to evaluate, to watch those, and if we can survey their performances, that would be good. But, Mr. Chairman, I thank you very much. Thank the board for everything that I've heard so far today, and I do want to put a congratulations out to two persons who won their primary, and I'm excited that they're on my side of the table. Thank you.
Well said. Sarah May?
No additional comments.
Okay. Dr. Hans?
Yeah, Jacob's story is truly inspiring.
Yeah, it was.
I cannot say enough about how he's giving back to the community for receiving so little from us. So that is truly inspiring, and I think it will motivate all of us to be focused on people that we serve. Couple of things and that I would like us to address to the community that we serve is one is about the issue of transportation. There is still a lot of confusion among the people how it's going to be delivered, what impact it will have. Of course, I'm sure they will be taken care of, but that needs to be addressed to them in a way that is reassuring. And similarly about the fiscal 25 budget, that is also looming. We are almost at the end of the fiscal year, and come October 1st, people have a lot of uncertainty in their lives, and it's creating a lot of anxiety. Thank you.
Thank you. Christina Root?
Just want to say I'm going to try and make it in person for our CAC meeting tomorrow, and I invite everyone listening to come as well, 9:30 a.m., or listen in online. Thank you.
Thank you. It's hard to believe that it's already going to be Labor Day, and I think it's a good time for us to take a pause on Labor Day to remember all those who serve those in our community, and all those who are caregivers, who labor in a different way, but each and every day, family and other members, hopefully they will have a day of rest on Labor Day. And I'm also reminded of the fact that our schools are reopening again, and we all know that our school children face a lot of challenges outside of the classroom, and we should be very cognizant of that. And be helpful where we can. I had a grandson start high school today, so I'm very cognizant of that. But I would like to, again, thank the Berman family for coming this evening. It truly was inspirational. On a business end, we do not have a study session this month, as we agreed at the COW committee, but our next meeting, Committee of the Whole, will be on Monday, September 9th, and I look forward to seeing all of you then. At this time, with board member comments concluded, I need a motion, a support, and a roll call vote for a closed session to consider under subsection H of the MCLA to consider material exempt from discussion or disclosure by state or federal statute as requested by our attorney.
Mr. Cowan, I think it's missing, but we didn't do a second round of public comment, did we?
Oh, you're
No,
absolutely...
it's not your fault. It's not on it.
Absolutely correct. Before we do that, I apologize. We have a second opportunity for public comment. Is there anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time. Zachary, you can go ahead with your 3 minutes.
Thanks, and good evening. I also want to harp on the transportation bit a little bit, and I just, again, reiterate, I'm familiar with On Time and Worry Free, who have both decided that as of October 1, they will no longer be contracting with OCHN. So I'm not familiar with the numbers on Worry Free's end of things, but I know that On Time provides services to 168 people. My understanding, too, is that the list OCHN has been providing families, maybe not families, but definitely support coordinators, social workers, and providing agencies, is mainly made up of residential providers. There's a few vocational providers that are on that list. And these places, most of them already are on the wait lists that we've been talking about for the past year or more. So it's a really troubling scenario where you look at, I work closely as a board member at New Gateways, so I can really only speak to their numbers, but we have roughly just around 20 folks that are looking at not having transportation to go to their daily day placement. And so far, I think 7 people have been able to sneak in to other transportation agencies that are planning on contracting with OCHN. The scary thing here, though, too, is I'm hearing reports that a lot of these providers are saying, well, yeah, we're going to just have to blow these routes up and, pack them full. And the reality then is we're looking back at the Medicaid violations if routes last for more than 60 minutes. I know that OCHN is probably buried in those rights violations just on the daily as it is now. So, as much as I do, we're in horrifying times when it comes to even just the transportation aspect. I know a lot of providers have attendance policies now for folks that have a higher absenteeism coming out of COVID, where because they're on wait lists, they're having to make drastic decisions on those types of services to make sure their doors can stay open. One of the things that I also heard from OCHN folks was that there's the providers that are feeling the heat right now and feeling that these wait lists are too massive, and we need to figure out a way to stabilize the provider network. We're being told now that, well, there are heaps of providers that are just begging to get folks in their doors. So I would ask that OCHN release that list too, so we can maybe start helping these families get linked up with services, because there must be some sort of a gap in communication. And another aspect to that too, when we talk about wait lists and follow up on that comment about providers that are begging to get people in their doors. Meanwhile, you have other providers that have massive wait lists in the 60 plus, 100 plus folks. I heard a comment that, well, because OCHN has a quality department, there shouldn't be any disparity in services. Therefore, these people should be able to place anywhere. And I think, Pastor Jones, you said something that really hit on that, which was you have someone that you care about that's now being affected by this transportation nonsense. And I think I hope not, but there's a chance that you might be seeing a disparity in services, because On Time and Worry Free have been absolute gems and true allies of people receiving supports and services in Oakland County for 20 and 30 years.
Could you please wrap up the comment? I've let you go a little while, so if you could.
Oh, sorry, I didn't hear the ding. Yeah, I'm sorry.
Yeah.
Yep, sure. I know you guys got to get in there. So anyway, please stay on the transportation thing. You'll have less than 2 weeks as of your next meeting to have any sort of discussion about it, and people are feeling really scared and really lost. Thanks.
All right, thank you. All right. Is there anyone else? All right, no one else? Is there anyone else in the audience who wishes to address the board? There being no one, we'll close public comment. Now, we'll go to the potential vote on a closed session to consider material exempt from discussion or disclosure by state or federal statute as requested by our attorney. We'll need a motion and support and a roll call vote. So moved.
Support.
Motion and support. Could we have a roll call vote to go in a closed session?
Mr. Furman?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Ms. May? Dr. Hans? Ms. Root? Mr. Cowan?
Yes.
Motion carries.
All right, and we are going to proceed to Huron, the Huron room, our typical. Okay, thank you very much, and we will continue the meeting in the closed session, and then come out of that to adjourn. Thank you.